I guess that's my cue. Am I good to go, Greg? Or I think I probably am. Hey, everybody, how you doing? It's me. Thank you for joining us today. We are hosting this virtual town hall for our staff and family. So hopefully, our board members and other people that are connected with the organization will be able to tune in wherever you are. Um, I know this technology isn't perfect, but one of the things, the positive things that we are experiencing about this dreadful experience that we're going through is that we're becoming much more virtually fluent, and we're pushing ourselves to avail ourselves of technology that will keep us safe and keep us at a distance from one another during this time. You know, I was thinking about an experience that I had in 2013. It was just before I took this position as CEO, and I had the chance to go to England for a week. My dad was from England, and then to Ireland for a week. And when we were in England, we went to his home, small village in the north of England, and he was thinking back over what it was like to be a little boy when he was just, in grade school, grammar school, during the build-up and during the Second World War, where planes were crashing in English fields and the rationing and it just seemed like such a distant, kind of almost a quaint, sort of thing to look back upon. And most of us have probably thought about different times in our history where we've encountered when the nation has encountered these terrible, challenging, and in some cases very dangerous and deadly experiences. And this is, to me, this feels like this is our time. This is our war. This is the time when we need to come together, and we need to do what's necessary for all of us, not just our programs, not just our organization, not just our cities and towns, or even the Commonwealth, but all of us that are in this world as citizens of the world are facing the kind of uncertainty and fear and financial anxiety, and it's a scary time to be alive on this planet. But I also know that this is the time when the staff of this organization will shine, and I know this because we are an agency that rises to challenges, and I'm so fortunate and profoundly blessed to be working with some of the smartest, most skilled, most experienced, and most dedicated people of my entire life. And so we've got the right teams here, guys, and we're going to get through this. It may not be easy, and there's a lot we still don't know about how this virus will manifest and how it's going to affect the people of this organization. But we need to be prepared, and that is what we are doing now. I'm going to give some general updates here, and then I've got Dan Lannon on the line. I can see him, but you'll notice I'm doing this from my office, so I'm really distancing myself now. And most of us have heard, and so after I'm done going through some general updates, I'm going to turn this over to Dan and possibly share Pitts to give some more specifics. There are families on this line, and there are staff on this line, and so I'm going to talk a little bit about how some of this is going to affect our families, in as much as we know that now, and how some of this is going to affect staff. So it may not all be relevant in particular detail to everyone, but I think it's good that we all have some awareness of what's going on, so that we can have patience and knowledge and confidence, and we can know that we've got a handle on what we need to do, and that we're doing what we need to do to confront this crisis. Most of us have heard by now that Governor Baker had a press conference this morning where he declared, or he issued an emergency order to close all non-essential businesses. across the state to curb the spread of the COVID-19. Now, some of us were saying, well, is that really any different? Because most of us have been staying in our homes. It's already reached frustration levels for a lot of people, but there are folks I know, family and people that have not literally not left their homes in a week or two, and we're learning more and more that the distancing, social distancing, is so critical for non-essential employees and citizens, and if you don't need to be out, if your families that are at home, I urge you to follow the governor's directives and only leave when you absolutely have to, because this is how we're going to get a handle on it. And you hear all kinds of language, but flattening the curve and all the rest. It's a responsibility to be socially distanced. You know, the interesting thing is this morning when I came in, I saw our parking lot full of cars, and it shows how much my attitude and how much I think in general of our elected officials and policymakers and the people that are trying to help us get through this, how much all of our thinking about this has changed so dramatically. Because a week ago, it seems like a year ago, but a week ago when we announced it was our first day that we had actually been closed of our congregate settings, and that seems so fantastically severe. And we, but today when I came in and I saw those cars, I thought, why do we still have all these people here? Because the more and more I've been hearing, we've got to keep people at home from spreading this disease. So, given that we are an essential business, we are one of the organizations like hospitals and other emergency personnel. We are caring for lives, and we are an organization that operates 24 hours a day, 365 days a year. So we don't have the luxury of just closing down, which means that we are going to require many of our staff, to continue to either help us to cover shifts in our residential programs, or to be on call to help us cover our shifts, or to work virtually from home in order to keep paychecks coming and mortgages paid and the business at hand happening without interruption. And we're going to be doing that. It's interesting. One thing that I've decided last week, and I was going to announce it on Friday, but wanted to wait until today then in the end. But I'm naming Dan Lannon, our Senior Vice President of Operations, to serve as our own head of our own internal COVID-19 task force, with Sharon Pitts working as his support in second in command. I'm giving Dan the complete authority and discretion to mobilize agency resources and the deployment of staff. Dan's going to be working very closely with Sharon and other program staff to coordinate communications, to work with the various agencies about direction and guidance. And there's so many things that we still don't know, and so many things that depend upon how many people get sick and when they get sick and where they are and how do we care for them. A lot of what we're trying to do here is also take our guidance and instructions from our own DDS and the CDC and DPH and some of the other federal agencies that are guiding the crisis, and of course listening to the governor and his orders. So as we consider the governor's recent order to close businesses, what does that mean practically for our families? Well, for our day families that have people coming just to our day services, that means that what you've experienced this past week is going to continue into the indefinite future. We don't know how long this is going to last. So I'll leave more of the details to Dan Lannon as far as if there's been any, the No Walls programs and some of the other things that have been running, whether those continue. We want to be helpful to you. Are those families that now have your kids home with you? We understand that in many cases it's a real challenge for folks that are at home now and maybe not understanding exactly why why they can't be with their friends, and it's probably making an already tense situation even more tense. I get it, and this is going to be a struggle. So I would like to say to you that if you have a particular hardship, let us know. If you have an idea for a virtual solution, something that you think that we can do, tell somebody about it or ask us if we can help. I can't make any promises here right now, and I'm going to have to defer how we mobilize resources to Dan, because Dan Lannon is really going to have the most current and up to date, sort of understanding of what we have to spare. But we have an army of caring, dedicated staff that are now going to be, many of them, some of them are already home. But if there's something that we can do to help during this crisis, let us know, and maybe there is. For all of our families, those that are residential and day, please, now is the time for you to start using Navigating Life. This is the app that NuPath has been working on for the past 7 years, and it could not have happened at a better time, because this is going to be the tool that's going to help you, our families, and other stakeholders stay connected with what's going on behind the walls of those homes when you can't get in there to visit. It's going to be how all of us stay connected and create a virtual community when we can't be face to face. I understand a little of what some of the families are going through, because my mother is in Benchmark Senior Living here in Woburn, and I haven't seen her for a week and a half. That's the longest I used to see her every single night. So my head's going a million miles a minute. What does her room look like? Does she have everything? Are they cleaning her wheelchair? Are they cleaning her walker? I mean, all these thoughts are going through my head. I have to trust the staff at her facility to do those things. And I wish I had Navigating Life to see pictures of her, because that would mean a lot to me if I could see her. So if you don't have it already, get it. Effective April 1st, we're going to be discouraging all of our staff from doing any separate emails, separate phone calls, separate text. Many of our long-term families have made arrangements with staff to stay advised of what's going on. Maybe it's an email at the end of the week. Maybe there's some other system that you've used. I really want to discourage staff from doing that. The time is going to be too valuable and too focused on caring for people to be worrying about some of those other means of communication. Navigating Life is how we are going to be communicating and trying to keep you connected. Obviously, if there's an emergency, if there's something urgent that has to be communicated, I'm not saying you can't make a phone call, but I want to encourage the families that have not yet taken it upon themselves to use this, to make this the time. This is how you can help us. And we have fast-tracked some new developments that is going to make this tool even more useful and timely at this time of crisis. We're looking at video conferencing so that people can communicate directly with people in the houses. And as well as a number of other things that may assist with trying to keep people virtually engaged during this time that we just do not know how long it's going to last. I'm going to defer anything more about some of the residential oversight to Dan regarding schedules, but I do want to say that to all of the staff that have already gone above and beyond the call of duty, that have gone into the homes, that are working other shifts, that are helping Dan and helping Sharon and helping our team of amazing directors and managers to fill these shifts. Thank you. Thank you from all of us. What you're doing every day is really at the front lines of this battle, and we need you. We need any staff person that is not otherwise deployed or doing something else to possibly fill a shift. And it may not be next week or the week after, but if this thing goes on for the weeks that they're talking about, then we're going to need to have a really robust and deep uh, list of people that we can call upon, so that we can rotate through. And again, I'll leave more of the details to Dan to talk about that. So I'm going to take a sip of water, and then I'm going to continue on with employees. So what does this mean for NuPath employees? I'm going to try to say this the right way. So regarding all the parking lot full of cars, there shouldn't be that many cars in the parking lot. So beginning tomorrow, all administrative and non-essential NuPath staff are not to report to this space or to the any programs, but rather to work virtually if that is possible. If you don't know if you can work virtually, or if you qualify that category, then ask your supervisor if you can. I think that it's safe to say that staff that are working directly with our people, and maybe they're not currently needed in a residential program, may be deployed at some future point. Dan is going to be giving some of those staff direction as to how and when they should consider how they may be deployed given their unique circumstances, because everybody's going to be used maybe in a slightly different way. And but the goal is to reduce the number of people that are coming together. This is all the advice that we're getting, and we're seeing this happening with more increasing speed all across the country, where entire states are being advised to heed the orders for social distancing. Stay home when you can. And so our goals are focused around reducing the number of people that are leaving their homes to come to work, exposing their family that is at home by coming to work, and so there are risks in this. We know this, but again, we are an essential organization. That means we don't have the luxury of not opening, because lives depend upon us and families depend upon us, and we have to figure this out together. And I am imploring our staff, and I believe, without a doubt, that the better angels of all of us will emerge during this thing, and I believe that we're going to have staff that are going to be willing to fill shifts as necessary. And hey, if it gets to that, I will too. I mean, we're all going to be called upon to do whatever it takes, and there isn't any of us that might not be asked to be deployed into a program and to use the safety protocols and follow the instructions to reduce the chances of getting infected with the virus. Staff that are not needed to work from home, so that is your function is maybe more of the direct client interaction, and if you're not working directly with clients, then there's not necessarily a administrative function for you to do. Those staff we will use their sick and vacation time to cover their pay. Now, we're going to do this until that pay is exhausted, and then it's our intention, because there's a lot of uncertainty as it pertains to our funding, all right? But it's our intention to continue to pay staff, full-time and part-time regular staff, for what their standard schedule would be. So that means if you're somebody that has only worked for the organization a short time and you haven't accrued very much sick and vacation time, so therefore you don't have a big a bank to draw upon, that we're going to continue to pay you, and you will see your accrued time show up as a negative balance. Now, that is for now, until we can figure out how any federal stimulus may impact or affect this organization. So you've heard all kinds of things. You've heard of the federal government's already passed 2 stimulus packages. There's a third one that they were hoping would get through on Saturday, and there's been a lot of advocacy for Bancorp trying to ensure that programs like NuPath and human service agencies that work for vulnerable populations will be supported in this. But that is not yet been made known to us. So we are going to try again to make sure that nobody suffers in this. We're all afraid about our financial well-being and security. That's only natural. And for staff that are out there that are feeling full of anxiety and wondering what this is going to mean, I would tell you that there's been some pretty interesting and some pretty big things being talked about at the federal level. And once we can get this a vote on this and it can get before the president to be signed, it sounds like that any of the aid that will be forthcoming in short order. And I promise you that we are waiting here for direction. And the second that we receive it, whether that be through additional time to pay for people's sick time, there's been all kinds of conversations about reimbursing people for if their kids are home. I'm not even going to even speak to some of the highlights because I would butcher it, and I'm not an expert in anything having to do with the actual legislation. But once it becomes clear how that's going to impact us, we hope to then be able to have a better idea of how this is going to look in the end. And it may be that if this mitigation money comes in to assist with providing employers with the money needed to give some additional sick time, if that comes to us and we're able to put it back, we will replace the sick time, the vacation time that we've charged you for, if we're able to do that, or to some portion of that, depending on what will become available to us. We are tracking every dollar and every expense and every action that is related to the COVID-19 because we want to have an understanding. We need to know what this is costing us as an organization and what this is costing our staff in terms of earn time and all the many additional materials and supplies and things that we're having to purchase to get through this. So we are. So I said it already once, but I'm going to say it again. We're still waiting for the state to authorize, or maybe I didn't say it, I don't know, to authorize the billing for our day program absences. So just as a reminder, and if you missed it last week, we are losing right now about $45,000 a day for the closure of our day programs and our day habs. We had thought by now, we were expecting it by this last Friday to receive guidance from the Commonwealth telling us that we could bill for these absences. We're not providing the service because people can't come in because we closed our programs because the governor provided that guidance and that mandate. We're doing our part by closing down. So we believe that we should be able to bill and that the money is there in our contracts. There's different ways of looking at it, and I know right now the state is trying to think about a whole swath of people that are affected by this. And what's happening, what I see happening is that the predominant concern right now, most of the preparation, at least on the state level, is around ensuring that we have the facilities to care for people when they get sick, that we have the hospital beds, that we have the supplies, that we're finding the masks, that we're getting these fundamental things that deal directly with people that contract the virus, and the testing too. I should have started with that because in my opinion, that's one of the most important things. But we know that as important as it's hard to argue that all of that is not the most important. Yes, people's lives are the most important. how people are going to be cared for when they get sick is important, how many ventilators we have, and so forth. But I'm thinking about the next step after that, and that is ensuring the solvency of this organization. And this isn't to scare you, because I am very confident that this is going to sort itself out. We'll figure this out. But it is a time where there's some tension and anxiety as we try to figure out how are we going to manage this. We're not an organization that's got this rich, pot of money. We don't have this endowment, this rainy day fund that by law we weren't ever able to retain more than 5% of our contracts. So, and not that we ever had that much to retain. So we don't have like a rainy day fund for something like this. And as a result, most organizations like NuPath would only have about 30 to 45 days of cash, which means we only have enough cash to last that long. It's not going to happen. But I want you to understand, this is a big deal for us, and we're trying to figure this out, and we're going to go day by day. And I'll keep you posted. I'm just trying to be as honest as I can, and I've had better nights for sleeping. Let me just say that. So the other thing, slightly related to that, and then I'm going to try to wrap up my part. Stay tuned, because Anchor, which is the federal trade, similar to ADP, but on a federal level, they were mobilizing an advocacy campaign on Saturday. Some of you may have gotten the email from ADP. Urging us to contact our state reps and legislators, because they were trying to get this into the third, something about shoring up and protecting our programs. And they're trying to get into this third stimulus package, but it didn't go through. The overall package is still being debated. So there may come another time where we're really asking you to light up the phones and email and be in contact with your state reps. Massachusetts is very supportive of this anyway, so there's other states where it's much more important, but nonetheless, I want you to be alert, because we may need to go to pull out our legislative muscles. Remember back in 2008 and 2007, and when we were sitting vigil at the State House, and those days we were trying to get 257 passed. It's like riding a bicycle. You remember your legislative skills. And if you're new to the organization, we'll teach you how. It's pretty easy. But I will let you know when it's time. And I know that I can count on a lot of cooperation so the NuPath can make its voice heard, and we can make a big splash. One point of kind of just as a reminder, please be wary of cyber safety and awareness during this time when people more are going to be working virtually. This is your personal life, private life, and professionally. Several staff got emails that looked like they were coming from me today, asking them for their phone numbers. Trust me, I am not going to be emailing staff asking for your phone numbers. That is just not something I'm going to be doing over these next few weeks. I guarantee you. And I'm not going to be emailing you asking you to buy gift cards or doing any other thing like that. If you get an email from me, if you're not used to getting emails from me, I would think twice about it. Look to see if you see the disclaimer, this warning that this came from outside, originated outside the organization, and be very wary of these fishing expeditions that, I don't know if that's what they're called, fishing expedition. Anyway, you know, the fishing, PH. Because this is how we will expose our network to potential malice, and, you know, leave it to those assholes to whatever, take advantage of people during a time like this. But okay, and lastly, unless there's something later on, we want to do everything we can to stay connected with you. It's essential. To my staff, I'm going to say it's your imperative. It's your moral imperative to stay connected with us. I hope that it serves somewhat to just remind us that we're not alone in this. By having these opportunities to be connected with the larger community, larger group, we're family. and we're all going through hard times, and it doesn't matter where where you are. This is a crisis that has affected everyone in the world, whether you're rich or poor, no matter what your race or creed, what your country of origin. It doesn't matter. We're all affected by this as citizens of this earth, of this world. And so, the one thing that I want to make sure that we do here is make sure that we feel some sort of connection with somebody else that's going through what we're going through. And I promise you that we're going to be using our greatest imagination and innovation and every tool at our disposal to make sure that as we go through this difficult and perilous and sometimes, yes, scary experience, that we're going to do it in the smartest way we can. And if there's anything we can do to make the experience better, if there's anything that we could leverage, any tool, any technology that we can mobilize to make the experience just a little bit better, we want to do that. And we need you, our staff and our families, to help us do that. So please be on the lookout as we continue to get more and more distance from one another physically. Be on the lookout for any virtual town halls or some as we have them arranged. I think we're probably going to do the family staff combined. It's just easier. If there's parts of it that aren't interesting to one side or the other, then you'll make that decision. And if there's staff that don't have a chance to watch it when it's happening, I understand. If you've got some busy schedule, you can't work that into your week, then you'll have to watch it later because they'll be available then on some sort of I think a YouTube channel or something. Make sure your emergency, this is for staff, make sure your emergency contact is up to date in Paycor. Please take a minute to log on from anywhere to make sure that we have the correct phone numbers to reach you at. And remember, you are responsible for checking your email, for participating in these virtual experiences, for watching my videos, because they're so great, and for staying in contact with NuPath during this closure. I'm gonna continue to provide as much information as I possibly can, but related to the specifics of how our incredible staff are being mobilized and directed and making decisions to ensure the health and safety of everybody, not just our clients, our staff, our families, all of us. I will turn it over to Dan Land and Sharon. A huge shout out to you, Dan. I don't know how you're holding up, but you look just fabulous.
Yes. Yeah.
I'll turn it over to you now.
All right, thank you. Yeah, if I had my option, I'd turn down the lighting in here. So thank you, Dan. Thank you. That was a great update and a lot of information. I have a few sort of just general things to add for both, that pertain to families of the individuals we serve, and then also to staff. And then I know Greg has informed me that there are some questions with people with their hands raised to ask some questions, and so we want to get a chance to be able to answer some of those questions later. I can't see them now, and so we'll go ahead and allow people that opportunity. And then at some point, we're going to bring Sharon Pitts into this conversation, and I know she has a few updates. She has alerted me of some, and I'll mention those. And if I forgot anything, she can certainly correct me. So as Dan mentioned, we're really waiting on a federal stimulus package. The third one, he had to really to fill in some details. And I know there was a call this morning, and I know a lot of people are waiting on information from that. Everyone saw Charlie Baker's press conference, and I think interpreted that a little differently, or had some of the similar questions that Dan mentioned earlier, which was, well, how is that different than what we were doing before? So we're gonna fill in those details a little bit more as we go forward here. We're certainly going to look to not have large groups of people in any one location. Not that we do really at this point, but there are a few contingency plans that we are working on behind the scenes that involve some people needing to be present here in this facility, New Boston Street, which is pretty spread out. So the discussion was, essential employees. Well, the main important piece that we want to get through, and as Dan mentioned, is, if you'll know if you're needed or required, your supervisor will contact you, or someone from NuPath will contact you and make you aware of what the need is at that time. And the reason we say it that way is because the need just might not be tomorrow or this week, but the idea is, not knowing how long this is going to go, the need for you to be able to make yourself available and help out and cover the number of things that we still have to cover to be able to provide services to those that need services. As Dan mentioned, I believe, or as he was going to mention, yeah, we currently do not have any confirmed cases here at NuPath of the COVID-19, and so we do have plenty of supplies available, and we're trying to really ration out some of those supplies. We do have some backup orders coming in. They're expected to be here on Wednesday, and we do certainly forecast having enough to go longer than Wednesday from what we have in supply right now. But really, that is, as we mentioned the other day, a very fluid situation as needs change so frequently. Also, people's sort of understanding of who requires a mask and who doesn't require a mask, or just the peace of mind that it gives some people, during this process is what we're working through, which is similar to everybody else. I think a lot of people, anxiety is high, and a lot of people are scared, and so we just want to make sure that we have a vast masks available and equipment available for the staff if one of the individuals is thought to possibly have this and might need to go out to be tested. We want to have a mask for the individual. We're hearing that is the most effective thing, that once that person was taken out of isolation, whether to go to a doctor's and be tested, that person have the mask on. But I know additionally staff feel want the access to that mask as well. So some masks and suits. We are constantly working the supply line. We do have two calls this week, as Dan mentioned. DDS, we have a call tomorrow with the region, and expect some updates from Kelly and her team on latest information coming down from DDS and specifics about that. I did have a conversation with one area director the end of last week and inform them of some of the plans that we have in place right now and some of the planning that we're thinking about, and I think that they've been supportive. I know that last week we did hear from DDS, and they said that if your son or daughter was at home, that they would not be able to return to the programs. We are still adhering to that. We are just trying to reduce the spread as much as we possibly can, and so we are staying firm on that. I know a couple parents reached out for clarification and talked with Michelle and Doreen, the directors of Res, and clarified some of those situations. So yeah, so that's still our expectation, is that if your son or daughter has been home with you, that they are not able to come back into the residential program as of right now. We don't have an end date or end time to that, as we don't have an end time to many of the things we're talking about. And then a second update we expect this week is the Executive Office of Health and Human Services will be updating us as well on and their the COVID-19 website, the mass.gov. COVID-19 truly is the most up-to-date information and continues to change regularly. It continued to change from what we knew, what was stated on Saturday to what we know to be this morning. And so certainly check that website out and stay up to date with that information as well. For staff, we do on Friday, they were sent communication for authorization to travel for essential employees. Karen Franklin and her team sent that out on Friday. And if you have any questions or issues with accessing that information in that letter, then please reach out to Karen or to Brett or to your manager and let them know. I think that is something that you want to have with you in your vehicle and on your person, because we don't know the extreme to when they'll ask for that, or how often they'll ask for that, or if there'll be curfew times, which is something that someone speculated earlier today, that will really be when they'll be mandating that. So as far as nursing, the nursing teams have been very busy. They're all accessible through FaceTime to the residential homes and to the support staff when necessary. There have been, I know, several doctor's appointments done virtually with the nurses to be able to fill doctor's orders, or to just get a health check, a status check on some of the individuals. And so really we're trying to access that and utilize that as much as possible. And really we're working through that with the nurses and the team so that they are able to do that and get, and speak to their doctor as needed. So I'm just looking at my notes to see if I missed anything here. I'm sure there'll be, some more questions for me as it comes up. We do have a few sort of contingency plans we have put in place and that we're working through. Again, it's not an ideal situation. I know a number of families and loved ones have chosen to take their son or daughter home with them, and we know that that can be a burden to do that. And so if there is any assistance we can offer to you all during that time, let us know. I can't say we'll be able to do everything, but we certainly will have some teams helping to make sure the houses stay supplied. And so we would be willing to extend that to our residential families who took their loved ones home as well. So certainly let us know. We want to be here to support you. And we know that, having them home suddenly at this unexpected time, you might not have had the time to prepare. And so we want to help you with that. Some other families had reached out today about once it got to a status of a state, Governor Baker declaring a more tighter lockdown or stay in place, that they would be interested in taking their son or daughter home. And so if you are interested in taking your son or daughter home, please just reach out to your manager of the residential program or the director, Doreen and Michelle, because if there is a supply pack that we can send you home with that will help you get through the next couple of weeks, masks and gloves and whatnot, then we'd like to be able to do that. And certainly, we would like to be able to, pack the medication as necessary and everything that you want to have go with you if that is what you choose to do. We're asking a lot of our staff, and I can't thank our staff enough. They have stepped up. They have been tremendous, both day staff and residential staff. It was a busy weekend, and we had a lot of call outs and a lot of flipping of shifts of people going to different locations because of parents taking their son or daughter home. And we're really looking at pooling our resources as far as staff wise, so that we can, so that we are being the most efficient as we possibly can with staff, because at this time when one individual might go home from this house and another house might have several individuals home, we're really trying to see how we can manage that. So again, Sharon Pitts, the Vice President of Healthcare Services, she's on the line. I think she's going to have a chance to chime in when we do questions. But that's it for me for right now, and we will continue to keep you updated. And as Dan mentioned, stay in touch, because we, operations is always a busy, fluid, full-time job, and it's certainly that way now. And although you might not be needed today or tomorrow, we will need you. So I don't know, Greg, if you want to open it up to some questions, if that's how we're going to address it.
Can you hear me, Dan?
Yep.
So I know we do have a couple of questions here, and Greg's also going to, if there's additional questions, what he'll do is raise your hand and he can unmute you so you can express the question directly. But I'll start by, I want to say one comment, and then I'll go to the questions that come from one staff. I have heard that in other organizations, their supplies of masks and hand gel, sanitizer, and gloves are being stolen by staff. And I know that's not something that we're going to need to worry about in this organization, guys. If you don't have the supplies you need, please do not take them from our people that need them so much. If you really need something, talk to your manager. We'll try to get you what you need. But I know that we can expect more from our staff. I don't want to hear that we're having these supplies stolen from our programs at a time when we're in such a crisis. That would make me very sad to know that we were doing that. If you need something, talk to your manager about it. Talk to Sharon, talk to me, and we can help you assess your need and get you what it is you need if you really need them. The last thing we need is for people to be taking things home if they already have enough or if it's not something that's necessary. All right, please, I beg you, let's not that be something that adds another layer of complications when our heroes are trying to do what they need to do on the front lines and taking care of people and making sure that they're not getting sick, or if they are sick, they're taking care of them. All right. So questions are there chances of being laid off? Yeah, laid off or furloughed or otherwise not reporting for work. I'm going to tell you the truth. I hope that doesn't happen. I am doing everything in my power to make sure that doesn't happen, and that if there's anything that can be done about it, I'm doing it. Now you can help me. And so if that text alert comes to you day or night, sometimes saying, go to this site, communicate with your state rep or state senator, that means you, that means when I tell you to do it. All right? We're in this together, and I am going to do as much as I can, and I'm going to work tirelessly till I'm dead to make sure that we're protecting these programs, because our argument is that not only do we need to worry about the lives of our staff and staff that are at threat of being without their pay, but we need to know that we have a programs and a robust system for our disabled men and women of the Commonwealth, the most vulnerable citizens of Massachusetts, to have to go back to when this is over. This will be behind us. This is not going to last forever. We just have to hunker down now and get through it. So this is the case that we're making. So we hope that does not come to that, because if it does, we've got bigger problems. Why do we have to use our own sick time if we're not sick? Well, a lot of people are sick. That's the best thing I can say. You personally may not be sick, but if this disease is disrupting commerce and trade and business and industry and schools and hospitals and churches and concerts and theater and sports and everything else, it's a pretty significant disease. And we need to I am making decisions on behalf of this organization to make sure that we're financially solvent. I know everybody would want to just get paid and not have to use their sick time, not have to use their vacation time. Wouldn't that be great? I wish we could do it. This isn't anybody's fault. Nobody asked for this. Nobody wanted their kids to be brought home from school, or to not come into congregate spaces, or to not be able to go out to businesses. It sucks. This sucks for all of us. But we have to do what we have to do, and if NuPath is not financially viable, then nobody has anything. And most importantly, our families and our clients that depend upon us so much will not have an organization to care for them. So that is why, I guess it's like a parent saying, because I told you so. It's not a good answer probably, but that's what we're doing. And what happens if we run out or we don't have sick time? Like I said, we're going to try to pay staff, and we're going to try to do that to the best of our ability until we can. And so we're taking this day by day, guys, and I'm not going to sugarcoat it. This is probably the most challenging thing I've been through in my professional career that any of us have been through. I started out this whole thing by talking about my my father's wartime memories. And for any of us alive dealing with this, going through this right now, this is going to be an experience like none other in recent memory, certainly in our generation. And so we have to expect some of these hardships and sacrifices, and not everything's going to work out perfectly, but we're here to listen to you. We want to make the best choices we can, and we want to hear if there's something that you think we can do that we're not. So that's that answer, and I don't know if it was a good one, but that's my answer. So what else are there? Greg, somebody got a hand up?
Greg, help me out. I have a couple here. I think you just spoke to this first one, but it seemed to have come up again. The question was the people in day services, if they're working the community with the individuals or day staff, if they're not to report to work, what's the plan to get them paid and as we go forward here? And I think you just covered that again. And I don't really have anything to add other than.
I would say this. I do have one thing to say. If you don't have a lot of vacation time or sick time, or you want to make sure that you're keeping some vacation time so you can still have a fun vacation this summer, because yes, we're looking to the right side of the future. There's plenty of things that you probably can do. Talk to Dan, but he's going to be looking to fill shifts. He's going to be looking to, there may be all kinds of things that evolve of needs that we have that don't currently exist as we try to figure this thing out, depending on how many people get sick and when they get sick, and we just don't know. We just don't know what it's going to look like. So if you want to work, I'd say there's probably work to be done, Dan, right? Is that right? I mean,
well, that's what I was going to say. And I actually talked to someone this morning. If you want to continue to work, there is work that has to be done, whether it's covering a shift, bringing supplies to houses, doing different things like that. Those are the people that will not have to tap into their vacation time or their accrued time off. And so, speak to your supervisor about that. It doesn't mean that you'll be able, the assignment that you're given is the assignment you're given. And so if you don't want to, execute that assignment, then you will use your time. But we do have sort of a list of responsibilities that we are managing out on a almost hour-to-hour basis, a minute-by-minute basis. And so if you want to continue to work, there is plenty of work to be done, and we could use your help. But if you are not an essential employee, which is we're deeming is covering the responsibilities of taking care of the individuals and the responsibilities of staffing and supplies, then yes, you'll be using your accrued time. So another question was more clarification on what this meant for individuals working in the community. So as Dan mentioned earlier, that we are closing our day facility programs for those non-essential staff people, and we are not going to be continuing the no walls groups or the community employment right now. And so we're going to ask managers and directors to work through those staff and families and let them know. But we are asking them to adhere to the sort of shelter in place that Baker referred to earlier. I don't see any other questions here, Dan. I don't know if you can see any other questions, or Greg, if I'm missing some, if you want to chime in.
Are there any hands up?
Yeah, there are a few hands up that I'm going to unmute, but one question was specifically from an employer of people who attend NuPath, and Dan, I just sent that your way, Dan Lannon.
Okay, thank
with
you.
respect to essentially breaking the news to those folks.
Mm-hmm. Yes. Yeah. So again, that decision, we just announced that today, and so I'm reading the question now as we go. Yeah. So yes, we will continue to, if we're not going forward with continuing the job supports or the community programming for them, and if they're an individual that lives by themselves, will we be able to provide some support to them at home? I'm paraphrasing what the question was, but just to let everyone know, yeah, we can certainly provide that and work through that. I think whoever reaches out to them or to the employer to let them know that that we're not able to provide the employment services with them, we will certainly do a status check for those individuals to see what their needs are. I know that so many of the individuals that we support live at other residential programs and served by other providers, and so so it might be contacting those other providers, or it might be doing it ourselves. But yes, whatever we can do to make this time easier for those people, we will do, certainly virtually. And I know so many people have that technology, and so to a simple check in or FaceTime or a supply run, certainly we will look to help them.
Okay, first person with their hand raised, who's the longest, is Carol Primo. Carol, I'm gonna unmute you in a moment, and we ask that you ask a question, and I'm gonna put you back on mute just in the interest of time and to keep this going. So we'll give it a try. Carol, are you there? Okay, we'll try next. Lee Wilmot, our own Lee, had her hand up. So Lee, I'm about to unmute you here. Lee, you're self-muted, so if you want to take yourself off mute and ask a question, feel free to do that. Okay, I'm going to go to Richard O'Brien. Richard, I am unmuting you now. Okay, we are 0 for 4 so far.
It was perfect.
And let's see, we just had a question come in from Amy Ivers. And that is, what if you just found out about a medical condition you have and now have doctor's appointments to look forward to? And what would that be covered under as, if that makes sense?
This is for staff, doctor's appointments?
Yes.
So again, I would recommend people reach out to HR and inform HR and go through the normal chain that they would go through as far as applying for FMLA, if that qualifies the medical condition. I don't know exactly what it was, and you would follow the same similar guidelines to making sure that you can be seen. Hopefully, if it's a serious medical condition, that your doctor is available for you. I guess that's our primary concern. But certainly reach out to your supervisor or to HR, and they can help you through the correct usage of time for that. But it would probably qualify under FMLA and the same process as usual.
Okay.
Are there any more questions that are written that we can't see here?
Well, they keep coming in between. So.
Okay.
Denise.
And by the way, I recognize that the time is now 3:02. We've gone 60 minutes, which is always my goal, to be no longer than 60 minutes. People know that I don't like it, but if there are questions that we could answer, obviously if you can't stay on the line, we understand, but we're sorry it's going over.
Denise, Connor, are you intending to reinstate without walls after the crisis is over?
Yes, most definitely. Yeah, and that's a great question, because we don't know how long really this level of the crisis will exist for, and certainly we have had separate discussions, myself and Dan in a smaller group, that I don't really, none of us really envision a day where all of a sudden it's back to work for everyone and everything's back to normal. This is probably going to be a slow sort of getting back to normal. Where we might see one program open first and another program open after that. And so that's certainly something that as soon as we can do that and we can manage that, and we have, the resources, again, the number one resource we have every day in this field is the staff, and staff completing, the responsibilities that we ask them to do and to work with us. And it's not an easy role. We know that it's not an easy job. And so, we're really looking to make sure that we're deploying resources, our staff, to the best safest situation possible, and that can help the individuals through this trying time, and families as well. I know, I mentioned that earlier, that if you have chosen to take your son or daughter home, and you certainly need some support during that time, please reach out to us. Please, we'll do whatever we can to provide that support, supplies, whatever it is, let us know, And, to speak, Dan, just you touched on it about people, equipment and masks and stuff and whatnot. I had heard the same from speaking with another provider about just necessities starting to disappear from their residential component as well. And so we just hopefully we don't face that same situation. And so I would just ask the staff that if they do need something, or they require something, or if there's something that they just are unsure of, just please ask, and the manager on duty or the supervisor, and if we have availability to that supply, we will certainly share it with you, but we really have to make sure that we have enough supplies for the staff willing to work with the individuals as needed. So all right, Greg, I don't know.
Yeah. Another question came your way, Landon.
Mm-hmm.
If people have no time accrued or limited amount, can they just take a few hours per week or pay period to cover their insurance premiums?
Yeah, assuming that, I guess it's a case-by-case basis, and so I would assume that person chose not to cover any shifts and to take this time right now unpaid. And what they're wondering is if they can just use the little time that they have available to cover their insurance. Yeah, I would say that is definitely doable. I don't know how much time we're talking about. I don't know how long, if that's a good long-term plan for that person, because if you really don't have much time, depends who you're listening to, how long this could actually go on for. And so I would encourage you to reach out to your supervisor, because there's a lot of needs in a lot of different locations for covering shifts, not necessarily the regular time that would be a normal work schedule. And I know that some staff have actually expressed how grateful they are not to be able to, during a time that their kids are at home and their husband has to continue to work, to have to come in and leave the house to cover their shift, that they'll be able to stay home during the day shift and pick up a 3 to 11 or a weekend shift. And so they're grateful for that, so that way they don't have to use all their accrued time or the little sick time that they had. And also, I want to remind people, the weekend, I know there was a similar staff that happened on the weekend where they didn't work 2 of the days at the end of the week last week because of childcare coverage, and picked up a longer shift on the weekend. And so we're certainly flexible, communicate with the directors, the residential directors and the staff, because we're also looking at, shift hours. A typical shift is I shouldn't say typical, because residential certainly shifts vary a lot. And so we can vary people's schedules quite a bit. So if you are looking to work and you want to work longer than your 8-hour regular shift, and move to like a 12-hour shift to cover need area, then let us know, because we'll take you up on that offer. We have to be able to manage that on the other end. And so you need to get the manager involved and get approval for that. But yeah, definitely, we want to have people, when they want to, be able to work their scheduled hours, so they don't have to tap into their time if that's what they choose.
One thing that we're talking about doing, and I'm just going to just allude to this just to let you know that we're talking about it. We haven't reached a decision yet, and we're waiting to hear what the stimulus package looks like. But we're talking about us applying some sort of a differential to NA staff that work directly in a shift. in one of the homes. So for those staff that are showing up and that are bravely, following universal precautions, washing their hands, doing all the things they're supposed to do and caring for our folks, some way that we could offer some amount of differential that would encourage and reward the staff that are showing up and coming in every day and filling these shifts. And how we apply that, how we do that, it would probably be some amount per hour, and we're talking about possibly having that given staff, through payroll as part of like a bonus of some sort. We have to talk about the details, but I wanted you to know that we're trying to work up some sort of an enhancement, a way to reward the staff that are really in the thick of things and are coming to do what's most important, and that's caring for the people that we support. Other questions, Greg?
Other questions are kind of repeats of what we've already heard, and we can reach out to people directly.
Okay, so if there's been a lot of information here, and I know we've gone on over an hour. I want to thank everybody that for your attention. We can track and see who has participated, who has watched, and if I ever get one free minute, I might just do that. But I want to thank the staff that have shown an interest. Again, I want to thank the staff and families that have sent little emails, texts to let me know that they're watching. They appreciate it. Justin Belmonte was over here today from the Martin Center, and he mentioned my video at by the Quabbin. So you can always way to my heart is to say like one of my video locations. But I'm a human being too, and I'm trying my best to make this worthwhile, and we're all trying to do the most uncertain of things and communicate them proficiently and at the same time, which is very hard to do. We try to figure things out and be transparent and communicate. So some of the information that we give may change. If I think about where I am today versus a week ago, any of us, it's just shocking to think. But the big takeaway here today is stay connected. This is not a time to fall into the shadows. Whatever you've got going on in your life, we want to know. We belong together. It's one of our core values, and even virtually, people need to know that we all need to know we're not alone. That there's other people out there that understand us, that appreciate what we're doing, that understand how hard it is, and we need to stay connected during this time. So we're going to try to create those venues, those opportunities, and it's up to you guys to take the time when you're home and you're doing whatever, you're binge watching on Netflix or Hulu. Set aside some time to check your email. It's the thing to do, and we know that we can count on your support. You guys have already made me so proud, and I know that you're going to continue to do that. And I just want to thank the families for their patience and just working with us and during this time of challenge. I'm still ain't afraid. And I know we got this, because what other choices we have? If we're going to figure this out, we will. And I know we'll do it together. Anything else? Is that it, Dan?
Yeah, that is it. I would, just to echo that. Thank you. I've received so many texts and emails from parents and just nice well wishes and thank yous. And so, I pass those on to certainly to the staff and just everyone that I could communicate that with too. So that is appreciated, and thank you. And again, thank you to all our staff. We truly appreciate them now more than ever, I guess you would say, and certainly we will continue to keep you updated.
So we're going to try to schedule something for maybe Thursday afternoon, unless something comes up that before then. So stay tuned and make sure you check your alerts and your emails. All right. Well, nothing else from me then. We're going to sign off. Go wash your hands. Stay safe, guys. Take care of your families. Be well as you go into this world, okay? Bye.
Take care. Thank you.